हेलो एंड नमस्कार सभी को। मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेज लाइव सेशन। वार्म ग्रीटिंग्स एवरीवन। आई एम दिव्या and I'm excited to connect with you all in the session. Today we are going to discuss about prevention of waterborne diseases. So let's get started. We have our expert Dr. Umesh Sharma for today's session. Dr. Umesh Sharma is a consultant with the Department of Hospital Internal Medicine and an assistant professor of medicine at the Mayo Clinic College of Medicine. He has 15 years of an experience. Dr. Umesh, you always bring lots of information to our viewers. It's really nice to meet you virtually. So without further ado, let's welcome Dr. Umesh. Hello, sir. How are you doing this evening?
I'm good. Thank you so much for the invite, Divya. And it's a pleasure being back with eGlobal and having an opportunity to share my knowledge on certain disease conditions and helping our audience.
That's great. So without any delay, should we dive into the session?
Absolutely, sure.
Yeah. So as we are going to discuss about the prevention for waterborne diseases, so my first question is, what are waterborne diseases?
As the name suggests, waterborne diseases are diseases that are transmitted through contaminated water. So typically there are different microorganisms, whether it's bacteria or viruses or parasite, that can be transmitted through untreated or inadequately treated water sources. And people who consume those kind of treated or contaminated water can get sick. And that's how the disease transmits. So it's primarily water is a source of this disease spreading. That's why it's called a waterborne disease.
Okay. So moving to our next question. So what are the causes and symptoms of this waterborne diseases?
So as I mentioned earlier, there are different obviously causes, including bacteria, virus, fungi, and parasites. And for example, cholera is a bacteria, including, and there's another example called typhoid. Hepatitis is a virus. Shigella is a bacteria again. The other parasitic infections like giardiasis, amoebic dysentery, that can also cause waterborne diseases. And typically the symptoms of disease they range from mildly symptomatic. Somebody can have just mild fever, nausea, vomiting, mild diarrhea, to really a fulminant, full-blown diarrhea with cramping, sometimes blood, especially if you have dysentery. And sometimes you may lose a lot of volume, leading to signs of shock, where you have poor perfusion of tissues, you have low blood pressure, and this is when, or even way before then, you should be seeking medical care.
Thank you, Dr. Umesh, for explaining the causes and symptoms of waterborne diseases. So before moving to our next question, viewers, we are live on Facebook, Instagram, Twitter, YouTube, and LinkedIn. So you can join through your favorite platform and you can ask your doubts in the comment section. So moving to our next question. So how they spread these waterborne diseases, and can you mention like top 5 waterborne diseases?
Sure. So usually it's a fecal-oral contamination. So unfortunately, hygiene is not as well maintained at times as people would like to. Also, at times we have in certain parts of the world, specifically in some parts of India, where you have open sewers or where there's contamination of water bodies, where people use their water for contamination gets contaminated with fecal stuff, or there's poor hygiene where folks don't wash their hands properly. This can lead to spread of waterborne diseases. And the top waterborne diseases, unfortunately, in India are typhoid, hepatitis, dysentery. You have amoebiasis, obviously viral infections like rotavirus, or even hepatitis A can be spread through fecal contamination, and cholera in particular, especially when you have people in close quarters and there's an outbreak. So these are the more common waterborne diseases, especially now with monsoon. There's always a chance of contamination of water supply with uh, human waste, and there's obviously high risk of having waterborne disease spread real quickly.
Yeah. So as you mentioned, like these spread through water contamination. So my next question is, how can we prevent water contamination in our home?
So the way you look at it is what can you do as a person, as a family, as a community? The first thing we can all do is educate ourselves and our family members, educate about proper hand hygiene techniques, including washing hands, common sense stuff, right? Washing hands before and after using the restroom. If somebody's sick, you definitely want to stay away from them, preferably quarantine, isolate them until they have symptoms. Once the symptoms resolve, that's a different story. And especially if somebody's sick, have them not handle water or food sources. Ensure the water you're drinking is safe. For example, sometimes people use well waters, and the water may be contaminated because of overflow or just water runoff and contaminating that well supply. So regularly testing that well for waterborne disease is really important. Sometimes your city supply, unfortunately, might get contaminated. So using boiling water at least 1 to 5 minutes after the water gets reaches boiling point, that tends to kill a lot of uh, waterborne disease spreading agents. Storing water in safe containers, which are watertight. Maintaining your plumbing and fixtures properly, especially if when folks live in village, they may have septic tanks and there's a valve, making sure the valve doesn't allow any backflow and prevents any contamination is really crucial. As I mentioned earlier, if somebody is sick, quarantining them, and especially as long as they're symptomatic, so you don't contain other people, expose other people to these waterborne illnesses is going to be really crucial. But the bottom line is hand hygiene, proper water contamination, decontamination treatment, boiling water sources are really going to be important.
Yeah. So thank you, Dr. Mesh, for providing different ways to prevent water contamination, like the decontamination, boiling the water, and the hand washing. So thank you for that. So before moving further, let me tell you to all the viewers that eGlobalDoctors is providing diet consultation. We have variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health, and many more. So you can register with us today at eglobaldoctors.com and book your appointment to get a proper nutrition coaching. So, Dr. Mesh, like you told us the ways to how to prevent these water contamination. So, how can we prevent these
The way to
cholera?
Yep. So, as I said, the bottom line is personal hygiene. At the same time, I forgot to mention our society, in particular, our public health services have a responsibility to dispose waste properly. And in most cases, they do, but sometimes, things may not go as planned. At the same time, people are using outdoor or you know attending to their bodily hygiene stuff in open spaces. That's a pretty high risk of contaminating water sources. So as much as possible, if and when possible, ideally people should not be using outdoor facilities and obviously using indoor toilets. That's one thing you can do. Again, as mentioned earlier, if somebody's sick, quarantining them, using proper hand hygiene, and isolating them for that period when they're symptomatic and could possibly spread infection to others is going to be also crucial to prevent this fecal-oral contamination cycle. If you're sick, seeking early medical care, especially if you're not able to keep any water down, you're constantly vomiting, you're losing too much volume to a point where you're dizzy and weak, or you have extreme symptoms, extreme nausea, vomiting, fever, where you may have to seek a medical treatment, which is more than what you can do at home, is going to be also important. And obviously, keeping your water sources safe from contamination, boiling water is also going to be useful in preventing these diseases.
Yeah. So thank you, Dr. Mesh. So as we discussed about the causes, symptoms, and how to prevent these diseases, so can you please provide the treatments for these waterborne diseases?
So the treatment depends on the specific disease and its severity. Uh, the basic is oral rehydration. So this will, for example, if you're losing too much volume by throwing up or having diarrhea, you want to replenish that as soon as possible. Usually with balanced electrolyte solutions. One thing you get is Gatorade. A simple thing to make is, I remember back in India, is you get ORS, oral rehydration solution. the simple way of doing it is a glass of water with a pinch of salt and a spoon of sugar. That's a cheap and easy way of rehydrating yourself. Coconut water tends to be electrolyte well replenishing as well. If somebody has severe symptoms like uh, high-grade fevers, abdominal pain, nausea, severe enough to not keep anything down, you have bloody stools, cramping, unable to keep anything down, you may want to seek medical care because there may be specific treatments based on the disease you have. For example, if you have amoebic dysentery, you could be given medicines like metronidazole, tindazole. If it's typhoid fever or dysentery, you may be prescribed antibiotics. Usually, viral infections like rotavirus are self-limiting. What you need is supportive care. This is the same as well for hepatitis A infection as well. The other thing you want to remember is avoid self-treatment with antibiotics without proper medical supervision. And the key is prevention. If you see somebody who's sick, obviously quarantining them, staying away from them, at the same time maintaining proper hand hygiene techniques, and making sure water supply is safe, and boiling water is going to be the key to prevent uh, fecal oral contamination as well as waterborne diseases.
Yeah. So thank you, Dr. Umesh, for providing the knowledge for the treatments of waterborne diseases. So before hopping to our next question, viewers, eGlobalDoctors is one complete healthcare platform solutions for all your medical related issues and questions. And maze ki baat ye hai that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. So you can register with us at eglobaldoctors.com. So let's back to our topic. So Dr. Mesh, like we discussed about treatments, prevention. So I wanted to ask, if a person is infected with a waterborne diseases like typhoid or cholera, so what steps a person should take?
So I think the biggest thing is to seek medical attention as appropriate and as early as you can. And that's number one. Number two, maintain adequate hydration and take care not to spread your disease to others. Practicing good personal hygiene, avoiding handling food and water supply, and especially disposing your personal human waste properly to avoid contamination of water sources is going to be the key to prevent the spread of waterborne diseases, especially during monsoon season where things can be a little different than other times of the year.
Yeah. So thank you, doctor. So viewers, there is no need to worry because we are here to help you at the comfort of your home. And you can reach out to Dr. Umesh, our expert on eGlobalDoctors, if you need any help regarding your health problem. So Dr. Umesh, can you, like we have discussed so much on the topic. So I think those audience who just has joined us, so can you provide a summary for prevention strategies of waterborne diseases to those audience?
Absolutely. So the bottom line is, if there's one thing I want the viewers to remember, is to really prevent the spread of waterborne diseases, you definitely have to focus on proper personal hygiene, keeping your water sources clean, isolating folks who are sick and have symptoms, and seeking medical care, especially if your symptoms are severe or you are not able to take or keep liquids down. That's an indication for seeking medical care. So that's pretty much what I have to summarize waterborne disease. So I really hope everybody takes this to heart and stays safe and healthy during this monsoon season.
Yeah. Thank you, sir, for providing lots of information about the topic. I think our audience has got lots of useful information about the prevention and treatments of waterborne diseases. So thank you for that. So viewers, although you might have the symptoms of waterborne diseases, so don't need to worry because experts at eGlobalDoctors are here to help you. So you can visit our website eglobaldoctors.com or you can download our application now. So before wrapping up the session, viewers, are you looking for an expert second medical opinion for cancer treatment? Well, look no further because eGlobalDoctors is providing access to top oncologists from across the world. So, Dr. Mesh, thank you for providing the strategies and treatments for the topic, waterborne diseases. So thank you, doctor. Thank you,
Thank you. My
audience.
pleasure. And thanks for this opportunity.
So